as we are going to be talking about pain perception, pain management techniques for labor and pregnancy, breath work, kind of talking a lot about that. So first, I'll just let you know about myself. And my name is Jada Shapiro. I'm the founder of Boober. Boober is a platform where expectant parents and new families find all of their pregnancy to postpartum care providers like birth doulas, postpartum doulas, lactation consultants, and mental health therapists. Before the pandemic, we were all about matching people to in-person care. And since the pandemic, we have, like everyone, we've become virtual, and we're able to support you virtually wherever you are. So please know that we're here for you if you need anything, and you can always reach out. I also founded a company called Birthday Presence in 2002. So we've been in New York City for 18 years, teaching people childbirth classes, breastfeeding, newborn care, CPR. We run doula trainings and certified lactation counselor trainings all year as well. And I myself also am a birth and postpartum doula, lactation counselor. I'm a mom of a 12-year-old, and I have 3 stepdaughters aged 10 to 14. So that's a little bit about me. Dr. Jill Blakeway, who is here, is a doctor of, I'm going to do a little intro and then we'll let you. Doctor of acupuncture, doctor of acupuncture and Chinese medicine, a licensed and board certified acupuncturist and clinical herbalist, and founder of the Unova Center in New York City, which was founded in 1999. The Unova Center is an acupuncture and Chinese medicine clinic, which specializes in fertility, women's health, and reproductive care. As a practitioner, Jill is known for her intuitive approach to Chinese medicine, and particularly for her skills as an acupuncturist and energy healer. She's always been passionate about helping women achieve a healthy pregnancy, so much so that New York Times described her as a fertility goddess and named her as one of Manhattan's top acupuncturists. She credits much of her success to combining the ancient wisdom of Chinese medicine with modern conventional biomedicine. She's written 3 books, the best-selling book, Making Babies, a proven 3-month program for maximum fertility, Sex Again, Recharging Your Libido, and Energy Medicine, the Science and Mystery of Healing. And so we are very excited to have you here, and I'm going to allow you to talk a little bit more about yourself and your work, and then we'll take some questions from the audience, and some that were submitted and some from me. So.
Well, thank you, Jad. I feel like that was the longest bio. I feel like we've talked about me enough. However, I would like to say that I, many years ago, 15 years ago, founded an acupuncture department in a hospital here in New York, and we specialized in labor and delivery. And that's why I wanted to come and talk to you, because I learned so much on the labor and delivery ward. You can imagine doing acupuncture for women in labor. I was there for hundreds of births, and I wanted to sort of share that experience with you, because there's a lot that I learned that you can actually do for yourselves. And so that informs a lot of our obstetrics at Unova. We have a big team, but we are, as Jada said, we specialize in OBGYN, particularly fertility and pregnancy and postpartum, but all sorts of reproductive issues. We also treat the whole family. And it's worth telling you, seeing as you're all about to have babies, that we're one of the few pediatric practices in our area, and we do treat tiny babies. The tiniest was 2 weeks old for colic. And people always ask, well, how do they lie Zen-like while you put the needles in? And the answer is they don't, and we don't. We have we have a special machine that stimulates the points. If they're very tiny, we do sometimes use teeny tiny pediatric needles, but they don't lie still in a sort of Zen-like peaceful meditational state because they're babies.
Right. Really interesting to hear. Thank you. Yeah. And I just want to let people know before we continue on that you can drop into the bottom of the Zoom. There's a Q&A, which is a great place to drop your questions. That will be the best place, and I'll be looking at those as time goes on so we can field them to you, Jill. So yeah, it was amazing that you worked and really launched that program, which I knew of as when I was, early in my doula career. We always knew that there was this amazing program that was showing the great benefits of acupuncture during labor. I guess let's back it up a little bit. And if you could tell the group how do you work with somebody who's pregnant for the first time, who's coming to acupuncture? We always, I always recommend working with acupuncturists, but a lot of people are they're a bit hesitant when they're pregnant if they've never done it before. Can you talk a little bit about what benefits acupuncture and has on pregnancy, and how somebody for the first time might approach it?
Yes. Well, for the first time, you need to pick an acupuncturist who's kind of a fit with you. And you'll know, don't you? Someone who listens to you is really important. And someone who practices in the way that you would like to be seen. Some practices are a little cheaper, but they're all done in one room. We do a lot of reproductive medicine, so we have private rooms, and we probably spend a little longer with each person. And we start in early pregnancy. We see a lot of people in early pregnancy because fertility is one of our specialties. So when they get pregnant, we just look after them and we keep going. And we start with things like morning sickness, unfortunately, which starts, as you know, fairly early, and fatigue. And I don't think anyone prepares you for the crashing fatigue of early pregnancy. By the time you look pregnant, ironically, you're not quite as tired, are you?
Right.
But it's exhausting growing a human being, it turns out. And so we treat people in early pregnancy for that. And there are acupuncture points that are very well researched for that. And one of the things I should say is that acupuncture is a very safe way to treat yourself during pregnancy. You should go to someone who specializes in reproductive medicine, but it's very safe because it's very non-chemical. And before you take a pill, it's best to see if you can solve your problems with acupuncture. So for instance, I'm going to show you, this is a very famous point, but on the wrist, if you come just 3 finger breadths down, 3 finger breadths between the tendons on your wrist, right there, that is a point for nausea. And we needle that point. We also leave people with a magnet on that point, and they reinforce that with C-bands. And I rarely meet a case of morning sickness that I can't get under control. I have every now and again. There are the occasional people, as you know,
Right.
who really, really suffer. But for most, I can. And that's where I start, is with acupuncture. We also have herbs for morning sickness. And when it comes to herbs, you need to go to a very reputable practice. Herbs aren't as well regulated as any of us would like them to be, which means that practitioners have to regulate themselves. And you can imagine, because we're dealing with pregnant women, how utterly paranoid we are about that, and careful. And our herbs are sourced in California, and they're very pure and very good quality. And we know they're tested. We know that they have the active ingredients in and not other things, and that kind of thing. So sourcing of herbs is important. And I actually try not to give pregnant women herbs unless they absolutely need it. I just feel like they should get as much nourishment as they can from food, and we shouldn't be adding anything else unless we do. But I do sometimes give herbs for that. And then we deal with all the common pregnancy things, the laundry list of things. And when I first see a patient who's pregnant, I want to warn them and tell them what we can help them with, but I also don't want to jinx them. Do you know what I mean? I don't want them to think they're going to have all these. Right. So I try and hit a balance. Back pain, there's plenty of research that acupuncture works better than just about anything for back pain in pregnancy. And I always tell the patients, come and see us before your back gets really bad, because as Jada will tell you, there is nothing worse than giving birth with a bad back. Right. So give us some time. Don't let it go on. The first hint of a bad back, come and see us so we can start to put that right. And of course, pregnancy, particularly later pregnancy, is a real recipe for back pain. Right. But your center of gravity is off, your ligaments are becoming looser so that you can expand. And then, the common thing is patients tell us, I just bent over to pick something up and that was it. Right. So get you to an acupuncturist if that happens. But everything from swollen feet to rashes to headaches, it's best to, I think, come and see us for something that's very non-chemical before you try more invasive procedures.
Thank you. And speaking about that point that you just shared, actually, since we also really, part of this talk is focusing on labor and how we can support people or how they can help themselves. We know that several women people will find themselves nauseous during labor. Do you find with that point, can you show that point one more time?
I can. Actually, this is really helpful for nausea during labor, and I used to put needles in it for my patients. So you find the tendons on your wrist. Okay. There's 2. Some of you may only have 1. Apparently, we're evolving to only have 1 tendon here. So okay. Some people are very evolved and only have 1, but it's not that many. So most of you will have 2. And then you slide down and you'll feel a dip, actually, and it's about 3 finger breadths down. You feel your finger just go into that.
Yeah, just kind of slid in.
Yeah. Yeah, that's what you're feeling for. That's an acupuncture point. We can talk about this in a minute, but they are specialized tissue. And we do know that now. We have research that shows that. And you can feel them by the little dips. And if you get someone to rub this reasonably hard, you should feel your nausea go away. What it seems to do, particularly in labor, is it relaxes the diaphragm a little bit. And a lot of your nausea in labor is just congestion. I mean, you're very big and by that point, and your diaphragm's quite stuck. But it's a sort of diaphragmatic nausea I found in labor, whereas in early pregnancy, it's more blood sugar related.
Right.
And that's why people who eat little and often do better with their morning sickness. But in late pregnancy, it's because your stomach is squished up against your diaphragm. And that point is particularly helpful.
It's fantastic. Can we also just jump right into the point that, at least in all of our doula trainings, we've always been taught Hoku is how I've been taught it, which I tend to call the headache spot, you know, right? But I would love to have our listeners hear from you. You know, can you talk a little bit more about that point, the contraindications to when you should use acupressure points? When can they possibly bring on labor when we're not ready for that? Is that true? And how can it be effective? Yeah.
With acupressure, I don't think I'm you know, pretty certain you couldn't actually, but with acupuncture you could, and we have contraindicated points during pregnancy, and that's why I said you should go to a specialist for that reason. So some of them are sort of common sensey, like on the abdomen. And I think most pregnant women would not want you to put needles in their abdomen where their precious baby was. So I think, but we do not needle over the baby, which makes sense. Some of them are less intuitive, but important to know about. There's a point on the shoulder here, which I used to use in labor, and because it's very downward bearing. And actually, if you press it, don't do that, you pregnant people at home, okay? Try to press it.
Unless they're past 37 weeks, it's okay?
Yes, by then it's fine. But I don't think with massage you can really do this. But I wouldn't needle this point on someone until they were just, either I wanted them to go into labor and I was prepping them for labor, or they were in labor. But if you press this point, you can feel it be slightly downward bearing, can't you?
Yeah.
It has a kind of, throughout your body, if you're sensitive, you start to feel, as I press this, I can feel it right down to my pelvis, actually. And so that point is contraindicated because it gives a sort of downward motion. And this point that you mentioned is the command point of the head, Li4, Hegu. You're absolutely right. You got it in Chinese, which is really impressive. And it's a good point for headaches. It's not our own point for headaches. Here's what you do. You see this little V between your thumb and your first finger. You come up to the sort of highest point of the pad there, and then you can squeeze. And that gets rid of a headache. And that point is safe to do. It is a somewhat moving point, but only when used with other points. You know, most acupuncture points work in relation to other points. It's a bit like talking to a body in code, and I can explain how it works in a bit. But that point is a good point for headache. And certainly that would be a point we would do on pregnant patients who come to us with pregnancy migraines and headaches, along with other points to sort of treat the root.
Great. No, it's interesting. And, you know, we often use that as doulas. Sometimes we try it on people as a pain relief technique. It seems for certain people that it does really cut the pain of the contraction significantly, which is interesting. I've also had people kind of not want that sensation because it's a sensitive point also, right? Yes. I think if you're doing it right, it feels sensitive, but
yes. It does feel a little bit sensitive, and you know, always listen to the woman in labor.
Exactly. Like if somebody pulls their hand away, but you know, just in terms of the partner, you know, a lot of people may not have doulas or maybe solo. They can, you know, you could do it to yourself as well, although probably harder to do than to find whoever's standing around you.
Yes. And keep the people around you occupied. You're doing all the work. You just start handing out jobs. This is one, I think. But you can do this one on yourself. And there's another one that I found. I'll show you in a second because it's on the leg and I'll have to move my camera. But when I was working at Lutheran in this labor and delivery department, I was telling Jada before we came on the air that it was so long ago. I feel really old even telling you this. It was so long ago that we had paper printouts, and the contractions would come on computer paper in printout. They would all be rolled up. And I have no idea what happened. I guess they were just rolled up and put in this enormous chart.
Yeah.
But we would do acupuncture, and we would write which points we did when on the printout so that the doctors could assess what was working and what wasn't. And we had one point that we could see provoked contractions and dilated our patients. And it was really obvious that every time we put it in, they had stronger contractions and they dilated more. And the doctors would say to me, how does it work? And at the time, I didn't really know. It was like a very old point. I do now, and will explain. But I'd be like, I don't know, it just works. And we were given NIH money to study that point. So this is worth you knowing about. And I'm going to just move my camera to show you, because it's on your leg. So you are going to have to get someone else to do this. Let me see if I can get, there we go. So you know the knobbly bone on your ankle, on the inside of your ankle. If you just come up 3 finger breadths again, you'll find a little dip again. And that's the acupuncture point. It's called spleen 6. And I just tell you that so you can Google it and get a diagram, which is better than looking at me trying to do it on my leg. And that point is very responsive to acupressure. Also, as you're doing it at home, don't do it hard. You can find the little dip, but don't press it hard now, unless you're right at the end of pregnancy. That is a point we definitely don't needle until people are going into labor, although, you know, mild massage of it. So you don't have to worry about getting a pedicure or something. People always ask me that. It's fine to have your feet massaged and your leg massaged when you're getting a pedicure, but nothing too hard there. That point we could show help patients dilate, which I think is really interesting and useful.
It's so useful and so interesting, and we would probably see a lot less use of Pitocin, the synthetic form of oxytocin, yeah, right? If we had some staff acupuncturists, it would be kind of amazing.
Well, one of the things that we pioneered in that department, which was really interesting, is we realized that people who were being induced were having more pain because, of course, your body does slowly release endorphins as you go into labor. And if you don't get that chance, you stand a chance of having more pain. And so we developed ear acupuncture techniques to produce endorphins. And there are well-researched techniques in Chinese medicine that help you produce your own endorphins, and that can be measured with blood work. And so we were doing that in the hospital with people who were due to be induced, and we did that before they were given Pitocin.
That's so interesting. You would bring them into and have those endorphins into their system earlier on, because we know, right, Pitocin, unlike oxytocin, right, which is the natural hormone, which seems to lead us into creating our own endorphins. Tell us more a little bit. Right, that disconnect.
Pitocin does not. And so the doctors would give us warning that they were going to induce someone, and we would go in 2 hours before, and we would put the needles in the ear. Wow. And then actually clip an electrostim machine onto them, and really stimulate them to cause a sort of big endorphin dump. And we found if we did that, they then behaved pretty much like people who'd gone into labor naturally in terms of pain relief needs, which is also an interesting find, I think. It's why I wanted to come and talk to you, Jada.
It's fascinating. So is there anything, now I guess I know when I've gone to acupuncture, in times like when I was having some anxiety, etc., my acupuncturist gave me these seeds to put in my ear that I could then press when I was feeling a little anxious or concerned. I don't know if they're related at all to endorphin points, actually. I never even asked.
Yes, they are. They're similar points they were doing. We were just doing it with a lot more stimulation because we were trying to precipitate a lot of what acupuncture does is remind the body of what it's supposed to do, you know, to activate your body's own healing mechanisms. And so we wanted to precipitate a bit of an endorphin dump ahead of labor. So we were doing it with some gusto. But if you are in hospital and you're about to be induced, you could get your partner or someone who is there to rub, or you could rub your ears actually, and it's not quite as stimulating as what we were doing, but it would help, and it would provoke some endorphin increase in your bloodstream, just a little bit of that. So, you know, 5 minutes each ear. And when you're waiting to be induced, there's that sort of horrible moment where you're just waiting. You may as well rub your ears.
So interesting. And could you do this as well? Would you ever recommend a stimulation point to the ear during a contraction? If somebody could tolerate, I could imagine somebody not wanting necessarily to be touched on the ears, but would that be a similar point that you would want to take during a contraction?
That it's more ahead of time to get the endorphins into the bloodstream. That I'd go back to this one that you were doing with people in labor, Jada. That is more helpful, or the one on the leg that I showed you, spleen 6, or both. But you, when I said don't argue with a woman in labor, I find that women in labor, and I was one myself, we know what we want, do we not? And what we don't want. We're really clear about it. So I would always just take my key from the patient, and some patients found that really helpful, and some patients wanted you well out of the way. Fair enough.
Yeah. Definitely. So let's talk a little bit about breathing. I know ahead of time we talked a little bit about this. And one of the things that I wanted to talk to you about, as we're talking about in labor today during COVID, almost everybody in labor has to wear a mask during the labor process, which I think, so for those people who haven't been practicing, that is kind of one of the techniques right now. I teach in our childbirth classes, is just putting on your mask every day, actually getting used to this concept. I mean, we're used to it wearing it outside now, but it's different being inside and moving through your body and maybe exercising a little, and just getting like, oh, what is it like? But I would just love to talk a little bit. You talked about how do we release our diaphragm, get more oxygen into ourselves, feel like we're breathing well during labor. Any techniques you can share?
Yes, and just when it comes to masks, I just because I'm in clinical practice, the paper ones are easier to wear for a long time than the cloth ones. I have a cloth one to go to the supermarket, that's pretty.
Yeah.
we all have floral masks now. This is our fashion, 2020. But the paper ones, the ones like the nurses wear, are actually easier and to breathe in. So the ones they give you at the hospital are probably going to be easier than maybe a cloth one you bring with you. And I was also saying to Jada just before we came on, when back in the day when I was working in labor and delivery, if the patient got a very dry mouth in the crux of labor, one of the things we would do was have them hold their hand in front of their nose and mouth so that the moisture from their breath went back. Another technique is to hold your tongue at the tip, at the top of your palate, so that the moisture from your tongue goes back into your throat a little bit. I mean, obviously there are ice chips, but we would, in the heat of things, if that was not the moment for it, we would hold their hand in front of their nose and mouth, and it worked. And that is a bit like a mask. So I just want to say that might be one of the upsides. I know it sucks to have to go and wear a mask, and it's just one more thing. The people who gave birth just before you ended up doing it on their own and weren't allowed their partners. We had lots of Unova patients like that, and our acupuncturists were recording guided meditations for them so they had a familiar voice and things like that. And I felt so sorry for them because that was rough, I think. So yes, there may be an upside and in the recycling of moisture, and the paper masks are not too bad. That's why nurses can wear them all day.
Yeah. That's really
and
good.
breathing exercises. I always think, when I'm trying to prepare my patients for labor and I'm trying to kind of talk them through ahead of time, and it'd be interesting what you do here, Jada, but I always talk about the difference between pain and sensation, because we are taught to contract from pain. Obviously, if you put your hand into the fire, your reaction is to pull back and you contract, and that's to keep you safe. And this is a different kind of sensation. Obviously a very intense sensation, and because we've never felt anything like it before, if it's your first baby, your tendency is to try and retreat from it, and that makes everything harder. You sort of you scrunch up away from it, which just makes sense. So sort of preparing ahead in your mind that this is going to be an intense sensation that isn't actually pain. And you'll be in labor and you'll be saying she's an idiot, but it's just very strong. And that if you can relax in the face of it a little bit, it's much easier. And I think that's where in the first stage of labor, particularly slow breathing comes in. You know, that nice grounding breath as the contraction comes on, slow, because then you're sending your body the message, I'm not in a panic. Deeper breath than you know, your temptation when you feel a strong sensation is to breathe shallowly. And certainly in later labor, there are some reasons to try those kind of breath patterns, but a nice slow centering breath where you notice that you're moving your diaphragm a little bit is, I think, really helpful. And then as you get into labor, shorter breaths, sort of light accelerated breaths seem to help, don't they?
Yeah, definitely. I mean, I think, you know, that's one of the classes that I'm teaching right now at Birthday Presents, actually. And we'll put all of our, for everybody here watching, I'll give you all of our websites so you can find all of us. But that's one of the classes we're teaching right now, is just breathing techniques and some different techniques. But one of the ones that I've found is really helpful through the years as a doula, if somebody is breathing in a more shallow state and a little bit faster, as we can do when we first feel those sensations, I'll sometimes even just use my hand, and even virtually, right, to kind of coach the breath, right, so that we can kind of slow your breath down and help you take a little bit of a bigger breath. And so partners who are watching, if there's any partners out here, or, you know, birthing parents who have somebody joining them, you know, that when they give you that eye contact and say, no, really breathe with me, and just make that nice slow hand, and they can slow their hand down. And when you have something to stare at, a real focal point, I think it helps people kind of ground down as well. And that can help you kind of breathe a little more into your diaphragm or into your belly. I think sometimes the technique of thinking about sending your oxygen right into your baby, you know, brings the breath a little bit lower too.
Yes, yes, I think so. When I was working in the hospital, it was a public hospital, so a lot of our patients had very poor medical care and had not had much prenatal care, if any, which was, you know, shocking to me. I was, you know, I'm a Brit where everybody gets free care, and so this was early in my American experience, and so we were literally teaching them to breathe on the job, you know, as they were in labor. And I think that, and a lot of them were very young and giving birth on their own as well, which is you know, just heartbreaking and lonely. And so as acupuncturists, we have more time than other members of the labor team, and we would take it upon ourselves to just breathe with the patients. And I think it's just important to have someone to focus on, so that you start to feel calm. Looking someone in the eye who is calm is really helpful at that point.
Yeah, and I think that's what's been really interesting about virtual work. And I would like to hear from you a little bit, because I know that although we are starting to open back up a little bit here, and I think you said Unova is actually now doing in person again, is that correct?
Yes, we are. We're back in the clinic.
So we'll talk about that. But since we are so many people, and we are from all over the country, and in many places, of course, COVID is starting to spike in lots of other places, that in-person care may not be the safest possibility. And even if you are in New York City, you may still really feel like you prefer not to travel and not go in anywhere. And so I know that all of us who, although we were all in person, have found a lot of ways to work virtually. And I would love to hear, I think everybody would like to hear, like, how could somebody work with an acupuncturist virtually, where obviously the needle's not going to come into play anymore? How do you help somebody, you know, late pregnancy, labor maybe?
It sounds impossible, doesn't it? But you have to remember that acupuncture is energy work. It's a licensed and board certified version of energy work, and so, but it is a form of energy work. And I said I'd tell you how the acupuncture points work, so I'm going to start there and then explain how I can do it without. But when I was writing my last book, Energy Medicine, I wanted to look at the energetic effects of acupuncture, because quite honestly, we know a lot about the physiological effects. We know that, you know, you can measure them. We can show that acupuncture changes your brain on MRI and changes your perception of pain. We can show that acupuncture from thermal imaging increases blood flow and reduces inflammation and things like that. We can show from blood work that we can give patients an endorphin release. But I wanted to know how it worked energetically. And my first clue that it might is that the acupuncture points are quite specialized tissue. And we didn't used to know that. We could see on MRI they looked a bit different, but there was some research at the University of Vermont Medical School that looked at how the needle gets gripped at the acupuncture points, which is different to other parts of the body. And it turns out that the connective tissue winds around the needle like spaghetti on a fork and just stays there. And when it does that, connective tissue has a high water content because it has a high collagen content. And so when it does that, it's more electroconductive. And then I asked myself for the book, well, why? Why would we have these weird electroconductive points in our body? And the answer, and I think this is really interesting for pregnant women, is it lies in embryology. And I don't know how many of you have given thought to how your baby is creating itself, how it's communicating to organize that. But that we do know that these days. And the normal ways bodies communicate are through proteins in the blood or through the nervous system. But the embryo starts to become the fetus long before there's a well-formed cardiovascular system or central nervous system. And the way it does it is electrically. And there's a wonderful video on YouTube called Electric Frog Face, which is from Tufts University, that shows live a frog fetus growing. And it's just got lightning going across its face. And as it does it, and the way that a baby does it is the body creates these little nodes that then have a change of electrical potential and bud off the next part of the body. So there's one at the elbow that buds off the forearm, for instance. And if you overlay a map of the acupuncture points over these embryological nodes, they're in the same place. So the very tissue that is highly electroconductive that was used to create us can be used to regulate us once we're here, which I think is really interesting.
Wow.
And then I told you about that point on the leg that the doctors would say to me, how does it work? And I shamefully would say, I don't know, I just know it does. And they would look at me in horror. Well, when I was researching the book, I realized that, how does a point on the leg dilate the cervix? We can show it does, but how does that message get through? Well, it turns out that slightly electroconductive tissue is attached to fascia, which is another form of connective tissue. And if you look at a map of the fascial planes, they're pretty much in the same place as the major acupuncture meridians. So the Chinese, thousands of years ago, without MRIs or sonograms, worked out a conduction system of electrical energy in the body, which sends signaling and prompts the body to recalibrate and come back to homeostasis. So while I was writing energy medicine, which I did, it came out last year, just in time for me to have to go virtual. In fact, I went all over the world and I talked to healers and scientists about how it works, how the body can be prompted to heal, how placebos work, how acupuncture works, how Reiki works, if it can be measured. And I was really looking for the science. I'm quite a sciencey writer. My book, Making Babies, I wrote with a doctor. I like to know the science behind how things work. I like to ask questions. And one of the things I learned how to do was move energy, just like I would with needles, by using a combination of my mind and the patient's mind. So most of the Unova team have now gone back to the office, but I am still here on virtual. And I was telling Jada before, I haven't seen new patients for 10 years because there was such pressure on my personal practice after Making Babies came out, and I was just full. But I am now, and I'm doing it on Zoom, and I'm doing, I create a specific guided meditation for each patient, and I just bring their awareness to where I would normally put an acupuncture point, and we talk about what we're trying to wake the body up to do. I am getting, as surprisingly to me, as good a results as I would have got in the clinic. I had a new patient last week with hot flashes. She's a menopausal patient, and we did one treatment like that, and she hasn't had a hot flash since. And really what we did is we just used my knowledge of placebo in so much as what your mind can focus on and the way it can awaken awareness in your body. And I have great fun designing a different meditation for everybody's permutation.
That is really interesting, very fascinating, and
Yeah.
also seems like it would be, really effective, right? This idea of guided meditation for labor, that's another real
Yes.
clear pain relief technique.
Yes.
you
Well,
know.
combining guided meditation with some, with good anatomical and physiological knowledge and a knowledge of the Chinese meridians and how that network works turns out to be really useful and a nice way to get treatment if you want to stay at home, which I think a lot of pregnant women do actually, and quite rightly at the moment. And so we can do that. We can prep people for labor. And I've done this a long time. So I'm a source of tons of advice. I've seen most things, probably like you, Jada. And, or I can point you in the direction of someone who will know. So I've been doing herbal consults, fertility consults, pregnancy, wellness consults, and combining them with energy medicine.
Wow, that is wonderful. That's great to hear. And we will type your out. People can reach out through Unova if they're interested in doing some type of a session to prepare. I know let's talk a little bit about just in general as we continue on pain relief, right? Are there any other tips that you have or ways or points, or even if you could maybe talk a little, right? Like sometimes people we find stroking of the hair during labor seems to help people shift their pain perception, or a very light stroking touch on the skin. Can you talk a little, like you might be able to tell us why, like if I move the hairs on my arm or lightly move the hairs on my head, can you explain at all about why that would work to help me perceive my pain differently in labor?
Well, it's really just as simple as your body has trouble multitasking. and so it takes your mind somewhere else. Although on your head, you have points that are on the gallbladder meridian, as is this point here. And that goes all the way down to the genitals and is one of the meridians that we use for pain relief. So some women I find like gentle stroking on their head, that is more about comforting and gentle sensation in the middle of confusing sensations. And some women really like to have their head massaged. And so it's worth trying those things out. You never know till you try it.
I always say that to people in labor, and like, right, just to try, like, we don't know what's going to work on you. We know what things commonly work for many people, but I think for the partners out there who may be supporting moms and birthing parents through labor, to know that it's okay to try something out. And right, like you said before, people in labor know exactly what they can and cannot tolerate.
Well, I always think that pregnant women in general are very sort of idiosyncratic and definite about what they do and don't want. It starts early with food, don't you think? People know what they want to eat and not want to eat. I was obsessed with anchovies when I was pregnant. I would have got up in the middle of the night and gone and bought some. It was like I must have anchovies, sort of thing. And that carries on. It's part of our mama bear protective nature, I think. We're very definite. We're definite about smells we don't like in labor, in pregnancy, aren't we? We're just like, absolutely not. Really, you can't go in somewhere, just an aversion.
Like aversion.
Yeah. Just absolutely. And it's always surprising to people who are around a pregnant person, because they can have been quite easygoing and suddenly they're very definite, like, no, absolutely not, I'm not doing this, I don't want to do that. And we're designed to do that, to protect our babies from toxicity and make sure that we have the right nutrients. We're amazing. And it's the same in labor. We know what we need, and so if you can try some things. I used to find rubbing feet used to help a lot of women. And that makes sense to us in Chinese medicine, because we're trying to encourage downward movement. And one of the ways that we reduce headaches, say, is we pull it down to the feet and start to rub the feet, and it just sort of pulls pain downwards energetically. Same thing, we're trying to encourage your body to think downward. And so rubbing your feet, and then you can incorporate that point I showed you, spleen 6, at the same time and rub it quite hard, in fact. And that sometimes feels really good. Foot massage is often a great idea.
Definitely. And so, if you happen to be laying on your side during labor, which a lot of people do choose for certain points of labor, sometimes we need to be very active. And so for all of you people who you might need to be really walking and moving, but in between contractions as well, we often need to find that resting place. Or some people really find that they wish they could lay on their side. They're very tired. They want to labor on their side. And when we do start to rub their feet during labor, they're able to stay on the side, or rest through. So
yes. And
Yeah.
that is a change. I had my baby almost 30 years ago. So things were very different. And they made us labor lying down with our feet in stirrups for
Right.
what seemed like a cruel amount of time. And it was mostly for the convenience of the doctors, I think. And this is in Britain, but I think it was the same in America. And I remember that we have midwives in Britain because there is much more midwifery, and they were very lovely. And the doctor really only came in to catch the baby. Like the midwives did all the work, and they were very sweet and kind. Yeah. And then the doctor showed up and put a little pair of Wellington boots on, we called them in Britain, and just sort of caught the baby. And I remember thinking, well, I'm not sure he earned his fee, but the midwives really did. So, but now, you know, when I was working in the hospital, even 15 years ago, people were moving around a lot more. And so a bit like trying out different breathing techniques, trying out what feels good to you. And it'll change through early labor. But squatting gets exhausting, but so you can't just do it and do it, but it does help. As Jada will tell you, it helps, it opens up your pelvis, it helps the baby go down. Gravity is in your favor. And when someone is squatting, it's often helpful. The sacrum has acupuncture points on. The sacrum is that V-shaped bone at the bottom of your spine. And it has exactly like that. And you see those little holes in the sacrum. That's not a mistake in the model. That they're called sacral foramen. If you find those and massage them, that feels really good. So if you reach onto the sacrum, this is for your partner, obviously, you can't reach your own sacrum. And particularly not when you're very pregnant, and have him reach for the little holes there, the sacral foramen, and just really massage them well. You'll see that is really helpful, particularly if you're on a birthing ball, or you're leaning forward on a birthing bar, or you're squatting or something like that, because it just opens the pelvis a little bit more. It has an effect on the nerves there, and it opens the pelvis.
Yeah, I definitely find that people really appreciate having their sacrum. Either we call it the sacral press, and we press down with the heel of the palm, but often those two thumbs right in there. And we do talk about that at Birthday Presents. If you come into one of the longer childbirth classes, or just one of the Monday night pain coping series, we'll demonstrate some of these different things. We'll get up and get moving, and we share our screen a lot with you, so you can see some of what that looks like. But yeah, that's really really helpful. You know, are there any other techniques you can think about in general where acupuncture, or if somebody doesn't have acupuncturist with them? Although I do want to say out there, you know, at least before the pandemic, there are definitely acupuncturist doulas who go to labors, who join people in labor as well. So that's always a possibility if you start finding yourself going to acupuncture, trying it out, and then you're like, I really want this in labor. That is my one biggest regret from labor. Actually, I had my acupuncturist lined up to join. Labor took a long time. She lived far away. We kind of never called, but I still think about it 12 years later. I'm like, oh, to have had the acupuncturist there, or you know. So I just love, I'm so grateful for the work that you've been doing all of these years, and then to actually make it so we can understand it. Although I always liked a little, not totally, I never totally understood it. I just find that it has worked. And what I found so amazing about acupuncture for me is that there were several things I didn't tell my first acupuncturist. It didn't even occur to me to tell about, like, certain digestive things. That wasn't like why I was going. And then to see these problems that I had resolved that I didn't even, you know, it really hadn't communicated. So for me, it was such an amazing way to come in and connect with somebody and really see how our systems are so connected. You know, I think.
Well, I always tell people it stood the test of time for a reason. You know, acupuncture has been practiced for almost 5,000 years. Most things in medicine go out of fashion as they get replaced by other techniques. And acupuncture is still really beneficial. And when we're starting more and more in energy medicine, the book is called Energy Medicine, The Science and Mystery of Healing, if you want to read it. But one of the things I realized is there's a very strong scientific background to this. And it does help. And as for other things, we talked a little bit about getting people's awareness in line with their body. And one of the things that I talk to my patients about in pregnancy, I mean, there is no more pertinent time in your life to contemplate how much of a miracle your body is. Really, than when you're pregnant. That you can grow a human being, that you can squish your organs to accommodate a baby that's growing and growing, that that you can do this is an extraordinary miracle. And what it relies on is the part of our physiology that we always take for granted, which is that every cell in our body knows who it is and what it is and what it's supposed to do. And our health depends on cellular awareness. Our menstrual cycle before we get pregnant it requires an enormous amount of synchronization, and that all requires awareness at a very sort of deep level, and it's all autonomic. We're not thinking about any of this at all. And so what I try and do with patients is start to get their mind to support that awareness, and we do it by visualizing light as intelligence. And we see that as in Chinese medicine, your physical body is yin, it's matter, and your consciousness, the thing that makes you alive, is yang. And people always ask me, what is qi, and what is energy? And what it really is all the bits of you that aren't skin and tissue and bone, which includes your beliefs and your feelings, but also your awareness, your body's ability to be intelligent at any given time. And you can use your mind to really help with that intelligence. So it really makes sense to imagine intelligent energy as like a little ball of dynamic light that is transformational and warming, literally the stuff that animates you, that gives you life, without which you'd just be a body. And I always talk to my patients about this. You have a consciousness, obviously, you have awareness, but your baby has a consciousness. You have inside you someone who already has a consciousness. When your baby is born, you won't have to teach him or her how to breathe. They will just breathe. And that requires awareness of some, it's not intellectual, but it is intelligent. So I often have people in pregnancy, I teach them meditations that direct their mind to take their awareness to a cellular level. And we go through what's going to happen in labor. And we look at just prompting the body's awareness to do that. And we even use it to contact the baby's consciousness. But that's when we're, getting slightly more woo.
And
but that's fun too.
That's amazing. Do you have any of these guided meditations? Like, have you ever recorded them and given them to people, or that it's only like something you do?
I do it one-on-one with people, because everybody's so different. And we sort of, I design something for them, and we bring in their all sorts of experiences. I had a fertility patient this week, and when we were talking about, this is a secondary infertility case, what might be blocking her from getting pregnant, she suddenly, out of nowhere, if you just give people space to explore, if they feel safe enough to unpack things, people heal themselves, they do. And she said, I've never thought about this, but after my baby was born, they took him to the NICU without explaining to me, and I was beside myself. And from that, we saw just where she stored tension from that moment. And actually a terrible thing to do to someone just after giving birth. And she said, my husband trooped off after them, and I was left saying, where's my baby and what's happening and what's wrong with my baby? Everything turned out to be fine. I need to tell you that. Happy ending. But very traumatized mum. Honestly, when she was telling this story, my mum heart was in my mouth. I was like, oh, I can't, because you're so vulnerable just after giving birth, that any kind of shock. So I designed a meditation around that, and the pain that gets stored in your body when you internalize a trauma, even, what some people would think was a relatively small trauma.
Yeah, no, that makes a lot of sense that you were able to do that for them. So, and if people aren't doing a one-on-one session, there are guided meditations that are more generalized that people might want to try. If you've never tried, right, out there, guided meditation, this is a good time.
It is a good time in pregnancy, because one of the things that meditation teaches you is to stay present. And Jada will tell you, having attended lots of births, it's really helpful to stay present, particularly if you're having a long labor. There's no point in thinking about where you've been, and you just don't know. The future hasn't happened yet. So just staying present and dealing with this contraction. And one of the times I think it's really important to stay present is after you've had a contraction. I used to find that women would be anticipating the next one, and I'd be saying, rest, just just don't even think about it, and then you'll do the next one, it'll be fine. And it looks like a big task ahead of you, and yet if you take it moment by moment and you deeply stay in the present, it's all obviously extremely doable, because we all do it, and you will all do it, and you'll have beautiful babies and all be well, and people do it more than once because it's not that bad at all. Or they forget their more intense moments. But I do think that learning some kind of meditation technique gives you the opportunity to practice being very present and keeping your mind from going too far back or too far forward.
I think so, absolutely. And I would say, that we don't even think about that as a pain relief technique, but for those of you listening, that's really, staying present in that moment, knowing that moment in time is just this moment in time. And then you have this break where you feel actually like you do now. So we can handle this minute wherever it takes us. You will be, what is amazing to me is watching all these different people handle labor in all different ways who've never done it before. They do intuitively know inside of their body what they can do. And they find, what's amazing is if nobody tells you what to do, most people lean forward, they move around, they rock, they find their rhythm. We know that rhythmic motion really, really helps us also. It seems to focus our minds. So, it is all inside of you. Somebody asked a question, is there any specific visualization that you would recommend, or something to think about? And if anybody else has any other questions as we're winding up, this has been so interesting. Thank you.
It's been so fun. Well, Erica, I think downward. If you're visualizing, visualize down. Trust your body. Know that your body knows what to do in ways that are absolutely miraculous. You will wonder what you're going to do, and then you will find that you are in charge of your labor. You know what you need. You don't. We've already discussed. You know exactly what you don't want. But if you start to visualize in early labor, just imagine, you can make this quite abstract. You don't have to think of the actual organs, but I would visualize your baby happy and heading down, and your body can hear you. We say in Chinese medicine, where your mind goes, your chi follows, your energy follows, and your baby can hear you too. So you could visualize just something as simple as your baby surrounded by light, protected, safe, warm, content, and just slowly and happily floating down. And that would be, you could just do that over and over again, and that would be a beautiful way to connect to an experience you're both going through. This is your shared experience, you and this baby, which is very beautiful and intimate and miraculous, I think. And so anything that just sends them light from you and energy, I think is really positive. Thank you for asking, Erica. That was a nice question.
Yeah, that's really wonderful. And I would just add one other thought that I can think of off the top of my mind, is that a lot of people, when they hear the word contraction, they really think about this closing. It feels very closed and contracted, and that is happening with the uterus. But the cervix, which is the neck of your uterus, right, which is opening over the baby's head, it's opening and it's expanding. And so sometimes I think, our language really matters. You can shift to the language. You can think about the expansion that's happening inside of your body. It's not just closing down. It's actually really increasing. And so for some of us who are very body oriented, you might visualize your cervix, literally what it looks like, actually, opening, or the pelvic bones floating open a little, just this kind of openness. Or some people who don't want to imagine the cervix, they would rather see a flower, like a rose or something kind of opening. It just depends who we are. We all feel differently about our visualization. So I think that's another.
I think that's a lovely idea, actually. Yeah. That's beautiful.
Yeah. And then there's one more question.
Yes.
Thank you for all of your advice. How do these techniques work if you decide to have an epidural? Can these techniques be used in place of having an epidural, or with one?
Well, in the hospital, we did do births with just acupuncture pain relief, and because that's what the mums wanted, and they were perfectly successful. But we also help people with epidurals, and I'm such a big believer in just supporting women in their choices when it comes to this. This is your birth; you can do it your way. You can change your mind halfway through. You haven't lost anything; it's all good. And when you have an epidural, I think when I was an acupuncturist, what I did is you lose some sensitivity when it comes to pushing, but you're a lot more comfortable. You know, it's a trade-off. So I did more of those points that dilate the cervix, you know, that point on the leg. And this point is also quite helpful for moving because you have a little bit, or you obviously have less sensitivity to push, and that we don't want delaying things for you. So yes, all of these are worth doing. And in fact, they're important to do if you have an epidural because it's still your body knowing what to do. You've just cut off a little bit of sensation there, which it can be really helpful. But you're still supporting your body to do what it knows how to do best.
Well, thank you. So it's been so wonderful talking with you. I'm so grateful for this hour and I learned so much, really. So thank you so much. And I typed it in the chat, everybody, and we'll follow up with an email as well so that you have Dr. Jill Blakeway's information at Unova, where you can visit and you can set an appointment with a clinician in person if you're in the area and comfortable with that, or of course, a virtual visit wherever you live. With one of the care providers that are at Unova. You can also come to Boober if you need a birth doula, postpartum doula, or lactation consultant, mental health therapist. We're all here for you. We all work for the same, all of your families, helping you expand and grow your families. And
we love what we do, don't we, Jada? That's why we do it.
Yeah.
There is no more fun than watching you create your families, really. And I've done it so long that some of the children that I was initially involved in are now in college. And I have mums who still send me an update every year on their birthday. And it still brings me so much joy.
Yeah, it is so amazing. The first person whose birthday I was at is now going to college. So it's really crazy. It so goes cool. Fast. But anyway, thank you everybody for coming. Have a great Friday night or afternoon, wherever you are. And we'll see you soon.
Thank you.
Thanks. Bye-bye.